Good afternoon or good evening, depending where you are. My name is Walter Ricciardi. I'm professor of public health at the Catholic University in Rome and president of the World Federation of Public Health Association. And with the webinar today of the COVID-19 series, we're trying to understand why some countries have replied in a way that now their inhabitants are living a quite normal life, and in other countries that they are experiencing a serious catastrophic events. We try to understand with some outstanding speakers, in particular from Australia, Brazil, and Israel, with incredible protagonists of the management of the epidemic in their own countries. And in particular, I will give the floor in a few minutes to Stephen Duckett, Director of the Health and Aged Care Program at Grattan Institute, an economist, a fellow of the Academy of the Social Sciences in Australia, and of Australian Academy of Health and Medical Sciences that played a prominent role in Australia in advocacy to achieve COVID-0. And then Luis Eugenio de Souza will follow. Luis Eugenio is professor of public health at the Federal University of Bahia. He has served as municipal secretary of the health of Salvador Bahia and also as director of the Department of Science and Technology of the Ministry of Health, and is currently the Vice President and President-elect of the World Federation of Public Health Association. And the third speaker will be Professor Nachman Ash. Professor Ash has been appointed to lead the national efforts to control the COVID-19 pandemic in Israel, and is professor at Ariel University, the School of Health Sciences, the Department of Health Systems Management. I will ask Stephen to present the results coming from Australia. Stephen, what happened in your countries? What are the results that you are now having in comparison with other parts of the world? Please, Stephen.
Thank you very much, Walter. Just to give you an example of my life, today I returned to Melbourne, where I live, from Sydney. There is no restriction on travel. I did have to declare when I got off the plane where I'd been, and basically all of New South Wales is a green zone. I could travel easily on the train. I had to wear a mask on the train, had to wear a mask on the plane. There is nothing stopping me going to coffee shops anywhere in Sydney, events anywhere in Sydney. I went to a concert while I was in Sydney. So we live a COVID normal life. There is still a little bit of community transmission, 2 or 3 new cases, 1 new case a day, I think it is, in Sydney today. But essentially, COVID is not present there's no COVID community transmission. How did we get there? Last year, first half of the year, we had the same first wave transmission that everybody else did. We had restrictions on activity. By about June, we had eliminated that first wave. The borders in Australia were closed quite early. People coming into Australia have to go through a 2 weeks quarantine. In Victoria, where I live, there was an escape from quarantine, a breakout from quarantine. And over the last 12 months or so, for every 100,000 arrivals in Australia that are quarantined, we have about 5.5 breaches of the quarantine. And so we went into a rapid increase in community transmission, 700 new cases a day. A lockdown was imposed that lasted for 111 days, severe restrictions on activity, and that eliminated the virus. Big debate in Australia, but about whether we're going for suppression or elimination. We went for elimination, and we went back to normal. A couple of weeks ago, we had a football match of 75,000 people. So this is a COVID-free country. That has gone extremely well. Vaccination rollout gone less well. We're still very, very low vaccination rates, a lot of vaccine hesitancy, very, very slow rollout, basically due to incompetence of the planning by the Commonwealth Government. That's the good news, is we're COVID-free. The bad news is the vaccination rollout's going poorly.
I'll be back to you, Stephen, to understand how it was possible, how were the relationship between scientists and researchers and politicians. But Unfortunately, I'm afraid that the situation in other parts of the world is not the same. And one of the countries that was struck harder was Brazil. Luis Eugenio, can you describe a little bit the situation that you have experienced and are experiencing now in Brazil?
Yes, sure. Thank you, Walter. Really, Brazil is going through a very difficult time with threatening numbers in relation to the COVID-19 pandemic. We are in our third wave with a peak number of cases. In total, we have more than 15 million cases since February last year. That represents 7,000 cases, more than 7,000 cases per 100,000 people. Over 423,000 total deaths, which means 200 deaths per 100,000 inhabitants in Brazil. Brazil is the first in number of deaths among the countries with more than 100 million inhabitants. Our fatality rate is 2.7%, the third highest in the world. Excess mortality in April this year is 82%, currently the first place in the world. And vaccination coverage is very low. Only 15% of the population got the first jab, and only 8% the second jab. In sum, the country has 2.7% of the world population, but concentrates almost 10% of all infected people on the planet and 12.6% of all deaths, having applied so far only 3.7% of vaccines against COVID.
And what happened and what is happening in Israel? We understand that Israel has followed a different path, focusing very much on vaccination, isn't it, Malcolm?
Yes. Hello, Walter. Hello, everybody. We started dealing with the pandemic as everybody. So we had 3 waves until now. The first one on March, and then on June to October, and the last one December, January. And we had the same tools as everybody, using restrictions. We had 3 big lockdowns in Israel, and we used masks and distancing, and we built a big unit for testing, tracing, and isolation based on the on-front command. And we protected our geriatric institutions and enlarged the capacity of the healthcare system. But everything changed on December when we actually we used vaccination as a strategy. And we decided that we bring as much vaccination as we can, as early as we can, to vaccinate the whole population in Israel. We prioritized the vaccination. So first we vaccinated the older population, as done all over the world, but we had enough vaccines to vaccinate the whole population in a very short time. We, of course, used a careful planning to get to everybody. We delivered the vaccines to small places, so it was very important to us the reach out of the vaccines to every clinic. And we used our vaccine strategy on the HMOs. We have 4 HMOs in Israel, and they were the operators of the vaccination. Encouragement of the population to vaccinate was very successful, partly because we used the Green Pass that we started after the last lockdown, when around 2 million of our population was vaccinated, And the Green Pass allowed people to get into concerts and sport events and things like that. So the population really wanted to get vaccinated. Currently, we have 5 million people vaccinated. We are using, I didn't mention, we are using Pfizer mRNA vaccines, and more than 5 million out of our 9 people population are vaccinated with 2 jabs. And this is we left with about, in average, 10% of our population not vaccinated, eligible population not vaccinated. And if we look at the different parts of the Israeli population, we have around 15%, overall it's 10%, around 50% not vaccinated in the Arab population in Israel, and around 70% in the religious, Orthodox religious population in Israel. So fairly it's good numbers of vaccinated all around the population of Israel. Currently, we have a very low number of cases. If we were at the peak of the wave at around 1,000 cases per million, now we are less than 4 cases per million in Israel. And we opened almost everything, the markets, education, the sport event, cultural event. So we don't have 75,000 people in a football match, but it's not limited. It's so we had last week 20,000 people, and 2 weeks ago we had a religious festival, very crowded. Unfortunately, there was a great disaster there, but not related to Corona, of course. This is the situation right now. We are worried about the different variants, so we try to catch them at the airport or other entrances to Israel. This is a huge challenge.
Thank you. I was involved in the management of the first wave. You know, Italy, my country, was the first struck outside China. And advising the Minister of Health, I was instrumental to the first lockdown. And I know that politicians hate now this word lockdown. You know, they don't want it. And they are very difficult to convince that sometimes you need tough measures to tackle the pandemic. Can I ask you, what has been the relationship between science and politics in your country? And in particular, Stephen, how did you achieve such a good results? I can imagine that even your Prime Minister and your Minister of Health was in trouble because I know that there are some populist parties or some newspapers that are accusing decision makers to being a kind of dictators, you know, to try to impose a kind of health dictatorship and to ignore the freedom of choice and freedom of movement. What happened in your countries? How were you so successful?
So you're quite right, Walter. There was significant political division in the country. The federal government is a conservative government and by and large wanted to pursue a suppression strategy. The Victorian, most of the states wanted to pursue an elimination strategy. All of the governments argued that they were following the best scientific advice, the best medical advice. So they all had the same mantra. But in Victoria, where we had the 700 cases, the breach of quarantine, the government is a little centre-left government, a Labor government, and they, the chief health officer, was a very strong advocate for elimination. The premier accepted his advice. There was schools of thought. The Murdoch media, very conservative media, were totally opposed to the elimination strategy. So was the business community by and large. The Premier, whose name is Daniel Andrews, was referred to as Dictator Dan. But even though the reason we had this second wave was because of failures of quarantine, so a mistake was made, the public strongly supported the quarantine, the restrictions. I think because seared in the public's mind was seeing the terrible situation that occurred in Europe earlier in the year. And we didn't want to have the health system being overwhelmed. We saw the benefits of moving to zero. The benefits of getting to zero, going for zero, was a report we wrote, which argued very strongly that the economic benefits, the public health and the economic direction was exactly the same. That is, strong public health was better for the economy than a yo-yo economy where we closed down, opened up, closed down, opened up. So there was strong public support, even though the conservative media and the Commonwealth government, the federal government, were opposed to the Victorian strategies.
Thank you, Stephen. Luis Eugenio, we have spoken several times about the fact that in Brazil, the situation was very complicated, and you as scientists and public health professionals had to face additional challenges, having a federal government who is essentially a denialist of the situation. Can you tell us a little bit about how difficult it is to work in this domain in your country? And luckily, there was an incredible response by civil society and by scientific society. Can you tell us a little bit about this?
Yes, I should add, Stephen was mentioning the economic aspects, and I should add that you are living a hard social and economic crisis as well as a health crisis. We forecast that in 2021, the GDP will grow only 3%, a proportion that does not even cover the fall of last year when the Brazilian GDP plunged 4%. From a social point of view, there is an increase in inequality and even misery with the return of hunger, which had been practically extinct before. Now, almost 40 million people, 20% of the population, live in extreme poverty, that is, with less than $2 per day. And how did we get to this tragic situation? Between 2003 and 2014, the Brazilian economy grew rapidly, even during the 2008 global crisis. Social inequalities were reduced, the hunger was gone. Since 2015, however, the country suffers from an economic crisis, and the policies to tackle it have not been successful. In the health domain, Brazil has a universal, comprehensive, and free healthcare system. Over 3 decades, the system has contributed to reducing child mortality and increasing the life expectancy of Brazilians. It has controlled disease that can be prevented by vaccines. A very important program of vaccination, of immunization, reduced the deaths from cardiovascular diseases and cancers. It has reduced inequalities in access to healthcare. In addition, our healthcare system has done well in handling previous public health emergencies, such as HIV, AIDS, H1N1, and Zika virus. Therefore, it was expected that Brazil's health system would put the country in a good position to at least mitigate the COVID-19 pandemic. But as you mentioned, Walter, to frustrate these expectations, strong negative leadership was needed. And unfortunately, we got it. In the economic field, the country's performance seems to be related to the insistence on fiscal austerity and budgetary cuts at a time that public expenditures would need to be increased to face the pressures posed by the health crisis. In the health domain, the highest political authority consistently denied the severity of the pandemic, stimulated the agglomeration, condemned measures of social distance and use of facial masks, promoted unsafe and ineffective treatment, and neglected vaccine production and procurement. It should be noted that this discourse has been repeated and disseminated by an active and centralized, very well organized network of communication via social media. Not surprisingly, the results of the 2018 presidential elections are strictly correlated with the incidence rates of COVID in 2020. More cases where the president-elect got more votes. And there is no doubt that the lack of coordinated, effective, and equitable response fueled the widespread propagation of the disease. Without a coordinated national strategy, local response varied in form, intensity, and duration, to some extent associated with political alignments. In fact, responses have been strongest in states where governors are in political opposition to the president. As you mentioned, it's important to add that the Brazilian civil society has reacted. Since the beginning of the pandemic, scientific and professional associations, unions, traditional churches, and social movements in general are very active, advocating for evidence-informed and nationally coordinated interventions to combat the pandemic. The Brazilian Association of Collective Health, affiliated to the World Federation, led the elaboration of a national plan to combat the COVID-19 pandemic, which recommends a series of actions from strengthening primary health care and epidemiologic surveillance to ensuring emergency financial support for vulnerable people and small companies. This plan was presented to health authorities at all levels of government. It has inspired local government and civil society entities. So we are in the middle of a dispute, of a struggle about how to tackle the COVID. But fortunately, we have a populist government that has many strengths and has promoted all it can extend any kind of action that is effective against the pandemic.
Thank you, Luis Eugenio. Nachman, what about Israel?
Well, as you said, every time that we had the big wave and we started to discuss lockdowns and restrictions, it was very difficult. And exactly as you said, the politicians, they don't like the restrictions and lockdowns, and therefore it was postponed. The decisions were postponed and were taken at the last minute, as much as I concerned. So I think that if we could get some of this decision earlier, we could have better results and have a lower number of cases during the big waves. The situation in Israel, the political situation is in Israel in the last month is more than that, 2 years, not stable. We had 4 elections and probably we are going to the 5th one. We have a transit government right now, and the decisions, and we had elections a few months ago. The decisions were influenced by this political instability, and it pushed the politicians to open as much as they can, to push to open as early as possible and as much as possible, and that put a lot of pressure on us, on the professional team. But eventually, I think that we have managed to put the professional decisions in front, and with the support of the Minister of Health, I think the bottom line, the bottom line is that we had quite good decisions, and as I said, if I look backwards, then some of the decisions could be taken earlier. To the third lockdown probably had to be taken earlier, but the bottom line is that we had good decisions. We influenced the politicians, I think, from the professional point of view, as much as we can.
Thank you. I start to pick up some questions from the audience. There are many of them. There are some that are specific to your countries. For instance, to Stephen, a very important strategy of controlling the epidemic in your countries is the green areas, stopping the mobility of people coming from outside Australia. How is it working, and when do you think it will last, this kind of approach?
So we closed the border to China very, very early in I think, a very good decision. And we've had closed borders ever since. Basically, I don't have the right to travel outside Australia. The border is closed for exit. People coming in, the only people allowed into Australia essentially are Australian citizens. And the Australian citizens who come back into the country have to be 2 weeks in hotel quarantine. I think that situation will continue probably, certainly till the end of this calendar year. We are having a very poor vaccination rollout, badly organised, and so I doubt whether we'd hit 70% of the population vaccinated by the end of the calendar year. And so I don't see the border controls being lifted this calendar year. There is not much public pressure to do so. The public likes the COVID-free lifestyle. And so even though there are economic costs to the border controls, they are not, those costs don't resonate with the public. There's been a little bit of a furore about closing the border by, we have a number of thousands of Australians are in India, and the border was closed to those. They were not allowed return, even they could not get flights. All the flights were cancelled, and even if they tried to transit by another country, that was made illegal. That has been lifted now, but it just shows the strength of the border control issue.
Thank you. Luis Eugenio, there are questions about have you felt been supported by WHO and by international organization, or did you feel isolated somehow and difficult? We saw terrible images coming from Amazonia and other parts of Brazil. Did you feel alone, or did you feel supported by the international community?
No, not at all. I think WHO has an important role supporting and recommending, making the recommendations for the Brazilian government very explicitly. Of course, it has no mandate to intervene in any country. That's international health regulations are very clear. WHO supports and recommends, but cannot intervene. Of course, there is now a big discussion about the need to revise this kind of international regulations to make countries accountable for their actions, since it represents not only a problem or a threat to its own population, but to the world population. But the problem was very localized in Brazil. It's our authority, our public political authorities that are denying the severity of the pandemic and are hampering any efforts from state governors, from mayors of cities, of municipalities that try to implement effective evidence-informed actions. So I would say we had important guidance from WHO directions, but we must recognize that our multilateral system needs to be strengthened it needs to be more correctly funded with money that is not earmarked and to act in terms of the real needs of the planet's health. So I would say it's a moment, the crisis is also an opportunity to renew our multilateral systems. But the problem is not the WHO, of course. The problem is that we have a populist government that don't take seriously the pandemic.
Thank you. Nachman, there are many questions for you regarding the equitable distribution of vaccination into the different ethnic and religious group of your country. Can you say something? There are differences in the distribution, or you have tried to make it more equitable as possible?
Yes, we have tried to make it, well, it was equitable. So everybody can get the vaccines as needed, but we have some challenges because some parties or some parts of the population, we had to put more efforts to vaccinate. And you mentioned the Orthodox religious, and we actually met the rabbis, the head of this population, and we convinced them to call people to vaccinate. And this is how we managed to vaccinate more people from the religious parties. And also, we put a lot of efforts for the Arab population. We had to explain more about the vaccines and to deal more with fake news in the Arab population. And it was very important to bring the vaccines to them, to the villages, the small villages, also to the Bedouins in the south of Israel, to bring the vaccines to the villages. Otherwise, they don't come to vaccinate. They don't travel far to do that. So we had a lot of efforts for that. I saw that there are many questions also about vaccinating the Palestinian citizens from the Palestinian Authority. This is the first, it's of course the responsibility of the health ministry in the Palestinian Authority. We have professional connections with them. So we were able to give them some vaccines, not very much, as much as we had. And we also vaccinated all the Palestinian workers that work in Israel. And now we are negotiating with them. They have their own contract with Pfizer, and they are going to get vaccines in the next months. And we are negotiating with them as we can to maybe have a deal that we bring them some vaccines now and get from Pfizer later. So there is a negotiation. It's very important for us that they will be vaccinated in the Palestinian Authority, because we are obviously in the same epidemiological area. So this is relating to your question, the different parts of the Israeli population.
Yeah, there is another question for you from Andrew relating to the fact that Israel is, has a very important technical and scientific capacities, and also own manufacturing of vaccines and therapeutics. Are you using your capacity to do that, or are you at the moment using only, can I say, foreign, technologies?
Unfortunately, we don't have any manufacturing capacity for vaccines. We didn't have it before, and we don't have it now. So we have to rely on vaccines that are developed and manufactured outside Israel. We have a project trying to develop a vaccine of our own. It goes very, very slowly. Now it's in a kind of testing in research, but we can't rely on that. And we hope to use this pandemic to develop manufacturing capabilities in Israel for vaccines, but that will take years.
Thank you. So we are approaching the final round of our webinar, and I will ask the same question to all of you. How do you see the future in your own country and international? We know that unless everybody is safe on the planet, nobody's safe. So of course we have to work together. And that's also the task of the Public Health Leadership Coalition that we have launched yesterday in order to support international organizations, particularly for development of the next global pandemic treaty. But Stephen, can I start from you? How do you see the future in your own country and international?
As I've mentioned, the vaccine rollout has been poor. I don't think we're going to be fully vaccinated before the end of the calendar year, which means I think our borders will remain closed until then. I think we've purchased 160 million doses for a population of 25 million. So we've got 3 times as many doses as we need. We've given a trivial number of doses to Papua New Guinea, in the thousands, not the millions. And so I think some of the chat was about vaccine nationalism. I think we're seeing that in Australia. But I think come 2022, we're going to have to open up, and we're going to have to accept that there will be some transmission within the country.
Thanks. Luis Eugenio.
Yes, please. Thank you. I've seen, Walter, during this period, outstanding leadership among the people, indigenous people, and people from the slums in Brazil that are fighting very hard to survive and to overcome the crisis. Actually, our future is very uncertain. The situation is very much unstable. So we can, as well as continue in this critical situation and getting worse and worse, but also there are reaction, and we can move forward in the sense to overcome this critical situation and develop a track of new development and good health for all. 2 weeks ago, the Federal Senate installed a parliamentary commission of inquiry that is investigating the actions and omissions of the federal government in the face of the pandemic. We don't know what the outcome will be, but political authorities are being obliged to account for their behavior. If the parliament does not open an impeachment process for the president, which is unlikely, given the support to a significant number of deputies, re-election next year will certainly be very difficult. So all Democrats in Brazil hope to see in 2022 a change for the better when it comes to governance. Thank you.
Thank you. Nachman, what about Israel and the world?
Okay, so in Israel, we hope that good status that we are in now will continue based on the vaccinations. But we look at the world and we understand it will take time that the world will get vaccinated, and so the disease will be with us during next year. We are worried about 2 main things. The first one is whether we will need a booster vaccination of the population because of lowering impact of the current vaccine. So we look very carefully about the infections of vaccinated people to see if the rate of infection vaccinated is going up. And the second thing is the variants. As I said, the main variant in Israel is the UK, the 10th variant. It's around 95% of our cases is the UK variant. We have about 1% or even less of the South African variant. And in the last few weeks, we had several cases of the Indian variant, 617.2 mainly, and we are worried about its rate of expansion. So we look at it very carefully. We try to learn from Australia about keeping our borders, but it's very difficult. In Israel, it's another culture, I think. So people like to go to travel abroad, but currently we restrict the travel to several countries. And we are looking very carefully at the different variants in Israel. And actually, every positive case today, we look at what variant is it. We are doing the genetic examination of the COVID to see what kind of variants, and look what variants are developing in Israel and what are coming from outside.
Can I have a very, very quick answer for a very difficult question that comes from the audience? Yes or no, favorable or not? What's your view about vaccine patent waivers? Do you think it's a solution, a possible contribution to the solution, Stephen?
What was the question again? Vaccine
patent waivers. I mean, this is
right.
Yeah.
I think in many previous examples, drug medication developers have actually had really substantial price discounts for third world countries, developing countries, and I think that should be part of the future as well.
Luis Eugenio.
Yes, I think patent waiver is an important first step, but we also need the knowledge sharing, and we need technology transfer to increase the production. At the pace we are now, the world will complete the vaccination only in 2024, which will leave space for variants. So even countries that has now, as Israel, high levels of coverage are threatened by these new variants. So I think it is interest of all countries in the world to increase the production of the vaccine, to accelerate vaccination. That would not be possible in the current state of affairs.
Thank you. Nachman.
I agree that anything that we can do that will raise the rate of production of vaccines is important. And if the patent waiver will help to do that, I think it's something that we can or we should consider. Of course, we need to see that manufacturers will and developers will do it next pandemic as well. So we need to take care of that as well. So I'm for that, but we have to think carefully how to do it.
Thank you very much. We have come to the end of our webinar, so I really want to thank all our outstanding panelists for their contribution today. I mean, your contribution was very important and informative. Thanks very much to the Royal Society of Medicine for hosting this series of webinar. I just want to remind that the next Thursday will be controlling the virus in prisons and secure locations. And I hope that you will come. And thank you very much to the audience and to the people that have participated in this webinar. Thank you very much indeed. Bye-bye. Take care.
Walter, thank you. Bye-bye.